On Victoria's virus fight, we're joined by the Federal Health Minister, Greg Hunt. Greg, good morning to you. Thank you for your time this morning. Really appreciate it. Another dark day for Victoria yesterday.
Good morning, Karl.
What was your reaction to all of that?
Look, firstly, just extreme engagement and emotion for the families, for Victorians that are going into lockdown, for those that have been infected, that they will have fears and concerns. So this is the moment where we have to support each other. Mental health is an immensely important thing, physical health support, and recognising that so many people are going through perhaps the most difficult time in their lives.
Minister, we're hearing that the state's peak is still weeks away, modelling suggesting daily case numbers could top 1,100. Why aren't we seeing results yet?
Look, firstly, we haven't seen those figures. I haven't seen them at the Commonwealth level, and I checked this morning and the Chief Medical Officer of Australia, Professor Paul Kelly, hasn't received those figures from Victoria, so I can't specifically comment on them. What I will say is this, that the four defences that we have, borders, testing, tracing and distancing, they're working incredibly well in 7 out of the 8 states and territories. In Victoria, we know there was the catastrophic hotel quarantine breach, but also the thing which needs very, very strong work is the tracing program. We've brought in ADF officials and personnel to help both on the ground and in the centre, but we need to make sure that the Victorian system is fully automated, that every case, every day is tracked down. That's what's allowed New South Wales, with multiple potential outbreaks, to track, trace and isolate in each of those cases. So we're here to help, support Victoria, support Victorians, but what is critical, Ali, in terms of what you ask, is to make sure not only are the distancing rules observed, but that each case is traced absolutely so as every contact is identified.
I understand that you can't, you haven't seen these figures yet, but they're on the front page of the Australian, Greg, and I'm not trying to be a smart aleck, but can we just get your comments on that? Because I think if you're a Victorian and you're reading these figures, you're going to read them more today. The modelling suggests that we're not going to hit our peak there until the last weeks of August, and significant numbers of new cases continuing to be recorded well into September and October. You must do you do your own modelling, and if so, does it go against that, or is it about the same?
Look, I've always been very careful on making predictions. What I do know is this, that those large numbers of cases are not going to disappear overnight, that we are going to continue to have cases, and all along we've said we're not immune, that this could be with us, and so for 7 out of 8 states and territories, it's about maintaining the important protections and not relaxing. In Victoria, now we have to go through this most difficult period, and we have to do two things: make sure people are safe, but also make sure that we have continued distribution. We have flexible approaches to the distribution of food and supply lines, and so we've stepped in to make those representations through the Prime Minister and the Treasurer on behalf of the community and the business community to the Victorian Government. So we will have a difficult period, and these cases will not just suddenly disappear, and anybody who says that, I think, will be doing a grave disservice to Victorians. We're going to have to go through the most difficult period in our history, I think, arguably the most difficult period, because these restrictions are unprecedented. People being locked in their houses by day other than for an hour or for shopping or work, people being locked completely in their houses overnight. It's like nothing we've ever experienced, and we say, it's difficult, but this is something that will help us save lives, but equally we have to get that tracing done so as it's every case, every day, every contact.
To hear that there were 15 deaths yesterday was incredibly grim, but we know that there is a lag between COVID positive cases and the death toll. To hear yesterday that one of those who passed away was a man in his 30s, I mean, it just affirms, doesn't it, that no one's safe?
That's right. This is a terrible, deadly disease. Over 700,000 lives lost officially around the world, and no doubt many, many more. No one is immune. It is far more likely to have an impact on the elderly, but it's not confined to that. So if you're a younger person, there is no cloak of immunity. There is no magic way of avoiding it. You might pass this on inadvertently to a senior or a grandparent, but each of us, every one of us, is at risk from a disease that can strike and take lives at any age.
Greg, just really quickly, in the front page of the Financial Review today, a really interesting story from Screw Turner. He's been on the show many times. He asked the question, are hard lockdowns producing better health, economic and societal outcomes than softer lockdowns or no lockdowns? Is there any hard evidence either way?
Look, there is, I think, very strong evidence that where there are not lockdowns, there's a significant capacity for the disease to spread if it's at a level within the community. When Australia and New Zealand went through their initial lockdowns, New Zealand had a harder outcome, but we ended up with a lower death rate and a lower case rate per capita. Now, however, what we've seen with the community transmission, which has come from hotel quarantine breach in Victoria, that the very high case numbers means that they have to use every measure available.
Okay.
And it's critical, though, that as we do this, that we do have the distribution. I just want to underline that point. That's something that the Prime Minister and the Treasurer have made known to Victoria in terms of the flexibilities that are absolutely required.
They're coming in over the top, in other words.
Look, our job is to make sure that the nation has continuous supply as well as safety.
Okay. Thank you, Greg.